Welcome dear friends. Today we are going to continue a lecture Techniques of Contrast Radiography in Animal Part 2. So this lecture comes in the SWAM MOOCs on the introduction of basic in veterinary diagnostic imaging. Myself Dr. Rahul Kumar Advaiya is going to present this lecture Techniques of the Contrast Radiography in Animal. So let's discuss about the contrast radiography of the urinary system. So in previous lecture we have already discussed about the contrast radiography of gastrointestinal tracts, peritoniography, cholecystography. Now today we are going to discuss about the contrast radiography of the urinary system. Under this, first we will discuss about the intravenous pylography or excretory urography. So this is a contrast radiography of kidney, ureter, bladder and the urethra. So with the help of this intravenous pylography, we can evaluate any type of abnormality related to the urinary tract, and this intravenous pylography also give a rough index of the kidney function. So this contrast radiography is classified in two phases when it depends upon the contrast agents. So one is first is a nephrogram phase, which is characterized by the diffuse opacification of the kidney, while the pyelogram phase, when the contrast agent reaches into the renal pelvis and renal recess, is called as pyelogram phase. Contraindication for this contrast radiography: you should avoid this procedure in those patients who are severely dehydrated. Technique to perform this contrast radiography: first of all, you should keep the animal off it for at least 12 hours and off water for 8 hours in a dogs. Then place the animal in a lateral recumbency. Afterward, you have to cannulate the cephalic vein, prepare the contrast agent. So for that you can use a sodium ethylamate with a dose rate of 2 to 3 ml per kg of body weight. If you are using the sodium ethylamate in large ruminants, you can use 0.5 ml per kg of body weight. So in dogs, it should not be more than 35 gram of total dose. After giving this contrast agent to the animal, immediately you have to take a radiograph. So both the view you have to take, lateral as well as the ventrodorsal view of the animal. So in dogs and cat, it is mandatory to anesthetize or sedate the animal, so that you can evaluate any type of condition which is related to the kidney. So here this is a ventrodorsal view of a dog after giving a intravenous pylography or after giving a contrast agent. So here you can visualize both right as well as left kidney After 10 seconds, giving to the contrast agent. Now after 5 minutes, most of the contrast agents are passed through the kidney. After 20 minutes, it is very difficult to visualize the kidney, while in 40 minutes, the whole contrast agent may get passed through the kidney. So this is a series of X-ray at different interval. Now this is a normal IVP in a dog, ventrodorsal view. Here you can clearly appreciate both the kidney, right as well as left kidney, ureters and the urinary bladder. So this is a case of dilated ureter and the renal pelvis. So the lateral view is clearly indicated the dilation of the ureter and the renal pelvis. The VD view, in VD view, it is confirmed that the right side of kidney is affected with this dilatation of the ureter. After intravenous pyelography, we will discuss about the cystography. This is another contrast technique which is related to the urinary system. So cystography means the contrast radiography of the urinary bladder. So indication for the cystography is to diagnose structural or any functional abnormality of the urinary bladder. So this cystography is contraindicated in those patients which is having atony of bladder. So for cystography, we can use positive contrast as well as negative contrast, double contrast as well as triple contrast technique. For positive contrast technique, we have to catheterize the animal in a sedated patient in lateral recumbency, and we have to inject the sodium iethylamate contrast agent inside of the urinary bladder and take the X-ray. In negative contrast technique, again we have to insert a catheter up to the neck of bladder and we inject. Before injecting the air inside of the bladder, we have to remove all the urine from the bladder. Afterward, we have to inject the air inside of the bladder, close the tip of catheter so that air cannot be leaked from the catheter side, and take a X-ray in a lateral as well as in ventrodorsal view. In double contrast radiography, we have to insert a catheter inside of the urinary bladder. Afterward, we have to inject positive contrast agent inside of the bladder, as well as we have to inject a lot of amount of air inside of the urinary bladder, and afterward we have to take a X-ray or the radiogram. In triple contrast radiography, we have to perform a peritoneography and cystography simultaneously and take a radiograph of a bladder. So this is considered as a triple contrast radiography. So here you can see the positive contrast cystogram in a dog. So catheterize the urethra, contrast agent is passed through the urethra to the bladder. This is normal cystogram. Here this is a negative contrast cystogram in a dog. So here you can see the urinary bladder having high decreased radiographic density, prostate area, which is showing enlarged prostate, and urethral stones. So this is a lateral caudal abdominal radiograph of a dog. Here again, this radiograph, the lateral caudal abdominal radiograph is showing double contrast cystogram in a female dog. It is catheterized. So this is a double contrast cystogram in a Dalmatian urinary bladder. So here you can see a radiolucent uric acid stone in a Dalmatian dog. So it appears black dot in over the positive contrast agents. In normal or survey radiograph, the uric stones are very difficult to appreciate. So this is an artifact. Sometime the air may get trapped in between the positive contrast, may causing this filling defect. So always this may causing a confusion with the bladder stones. Another technique related to the urinary system is urethrophy. So for urethrophy, again you have to catheterize the urethra, and the catheter should be placed at the tip of the penis, inject whole contrast agent inside of the urethra and take immediate X-ray after injecting the contrast agent. So in this lateral radiograph you can clearly visualize the urethra, penile urethra, membranous urethra and the prostatic urethra. So this lateral radiograph of dog, here you can see a radiolucent calculi present at the just below the os penis in a dog. It can easily visualize with the help of urethrophy. Another, this is a radiograph of a os penis. Here you can see the multiple radiolucent calculi present just below the os penis, which is visualized because of positive contrast urethrophy. Now this is a case of rupture of urethra. So the contrast agent may get spilled out from the urethral lumen to the pelvic cavity and the surrounding structure. So this is a lateral view. You have to clearly appreciate the contrast agents are spilling at different places. So after urinary system, we will discuss the nervous system, especially spinal cord. The contrast radiography of the spinal cord is called as myelography. So the myelography performed in those patients who are suspected for the intervertebral disc protrusion or intraspinal lesion. So the myelography is contraindicated in the case of meningitis or the myomalacia. For myelography, always used oil-based iodine contrast material. It is less irritable to the spinal cord. So for that you can use a metrizamide at the dose rate of 0.2 to 0.4 ml per kg of body weight in dogs, while 0.3 to 0.4 ml per kg of body weight in calves. Let's discuss about the technique of the myelography. Before performing this myelography, always you have to sedate the animal or anesthetize the animal. Okay. So, first of all, you should place or keep the animal in a lateral recumbency or the sternal recumbency. There are two sites for myelography. The first site is cervical myelography, another is a lumbar myelography. The site for cervical injection is atlanto-occipital joint, and the needle may get passed through this joint into the foramen of magnum in the space of subarachnoid. After passing this needle, you have to remove the cerebrospinal fluid from the space. As much amount you want to inject the contrast agent. Suppose you want to inject the contrast agent 5 ml into that space, you have to remove or take out the approx 5 ml CSF from the spinal cord. Afterward, you have to inject the contrast agent. Site for the lumbar injection or lumbar myelography, you should use a lumbosacral space or L5 L6 space or L4 L5 space. So again you have to inject the contrast agent in a subarachnoid space. So this is a lateral radiograph of a dog, this is a lumbar portion of the spinal cord, and this is a plane or the survey radiograph. It is very difficult to appreciate the lining of the spinal cord, so that the myelography is required. Here this is a normal myelogram. So this is a cervical myelogram. The contrast agent is just injected at the atlanto-occipital joint in the foramen magnum. Here you can clearly appreciate the boundary of the cervical as well as the thoracic spinal cord. This is a normal myelogram of a dog. So this is a lateral view of a lumbar spinal cord after giving lumbosacral myelogram or lumbosacral injection. So you have clearly appreciate the boundary of the spinal cord. Now after myelography of the lumbosacral injection, here you can see the L3 L4 disc protrusion. So between L3 L4 disc is protrude out and compressing the spinal cord. It is clearly appreciated after myelography. This is called as extradural lesion. Another interdural lesion or interdural or extramedullary myelography, here you can see one tumorous structure is present into the spinal canal and which is compressing to the spinal cord. It is clearly appreciated through this myelography, and arrow is denoting the lesion. Another is a intradural or intramedullary lesions. So here you can see one tumorous mass is present into the spinal cord. So in the myelography, here you can clearly see the dilated, reduced contrast of a spinal cord at the level of dilation, clearly appreciated here and showing with the help of arrow. Here you can see another myelography is there. Here you can see the first lateral view of a dog is showing the extruded intervertebral disc protrusion. Second lateral radiograph is showing the spinal cord tumor. Next technique is dicrocystorhinography. This dicrocystorhinography is a contrast technique which we can use to identify the nasolacrimal duct system, or in easy word, this is a contrast radiography of nasolacrimal duct system, dicrocystorhinography. The indication for that dicrocystorhinography is partial or the complete obstruction of the nasolacrimal duct in the animal, any type of atresia of a duct, any inflammation of a duct, deviation, distortion of a nasolacrimal duct system can be identified with the help of this dicrocystorhinography. Procedure: first of all, you should sedate or anesthetize the patient. Afterward, you have to cannulate the lacrimal puncta, which is located at the medial canthus, with a suitable sized cannula. Then you have to attach that cannula with the injection or syringe, which is containing the contrast water soluble iodine contrast material. Afterward, very gently you have to push the plunger of syringe and inject the contrast agent inside of that duct system and take a lateral radiograph of a skull. If any abnormality is there, then the contrast agent you will find at the level of abnormality or obstruction. Another contrast radiography is a xylography. Xylography means the contrast radiography of a salivary gland and the duct system. So, this xylography is performed to diagnose any space occupying lesion of the gland or any obstruction in a duct like Stensen's duct. If rupture of duct is there, then you have to locate the site of leakage of the saliva in a xylocoel. So, there are two methods of xylography, one is retrograde method and another is a direct method. In retrograde method, we have to inject the contrast agent into the salivary duct, and in direct method you have to inject, or direct or the antigrade method, you have to inject the contrast agent directly into the salivary gland. After injecting this, you have to take a radiograph of a skull or a salivary gland. So, this is some radiograph is showing normal parotid xylogram in a dog. Here you can see the parotid duct, which is denoted by A. Normal zygomatic xylogram in a dog, the zygomatic gland, which is denoted by the V, while the normal mandibular xylogram, the mandibular duct, which is denoted by the D, and submandibular branches, which is denoted by small d, and mandibular gland by M. Again, the last radiograph, lateral radiograph of a skull, is showing the normal mandibular xylogram. Mandibular duct is denoted by D and gland is by M, and you can clearly appreciate the large mass under the neck. This is again one of the radiograph of a horse. Here you can clearly appreciate the normal mandibular cyelogram in horse, the mandibular duct and the mandibular gland. Another is a normal parotid cyelogram of a horse, the parotid duct and the parotid gland. You can clearly appreciate in the lateral radiograph of a skull. Next technique for the next contrast technique is for the bone is osteomedullary graphy. The contrast radiography of medullary cavity of bone is called as osteomedullary graphy. Indication for the osteomedullary graphy is to visualize the interosseous and the extraosseous venous channel of a long bone. It to diagnose the delayed and the non-union of fracture. You can use this osteomedullary graphy in the case of degenerative arthritis, any bone tumor, osteosarcoma, osteoma, etc. For performing this osteomedullary graphy, you can sedate the animal and or anesthetize the animal, prepare the site for aseptic surgery, give a small incision just at the preferred site, drill the bone with the help of intermedullary pin or bone driller or a drill bit. After making hole in a bone up to the medullary cavity, inject water soluble iodine contrast material inside of the medullary canal and take a radiograph. So this is a whole procedure of the osteomedullary graphy. Next procedure is fasciography. It's a contrast technique to evaluate the normal tendon and associated structure. It's called as fasciography. So the fasciography is generally used to diagnose any adhesions of the tendon or any calcification, rupture of tendon, rupture of muscle, etc. Technique for that, you generally for fasciography, we should prefer a negative contrast material to perform this fasciography. We have to prefer the site, inject the atmospheric air or the carbon dioxide between the tendon and the muscle, inflate the area at least 100 cc of the air in a defined area, take a radiograph and you will clearly appreciate the tendon separate from the surrounding soft tissue. So this is all about the fasciography. Now another contrast technique which is related to the orthopedic, so that is orthography. Orthography is a contrast technique used for the diarthroidal joint. So this orthography is indicated for any type of joint abnormality, joint diseases, etc. But this orthography is contraindicated in the case of septic arthritis, while any infection near to the joint. So this is a very specialized procedure. Always you should be take care that any type of infection should not be enter inside of the joint. So this radiograph is showing canine shoulder orthogram. So there are two techniques for the orthography, positive contrast orthography as well as a negative contrast orthography. So this radiograph is showing the positive contrast orthography of the knee joint. A positive iodine based contrast material should be injected into the diarthroidal joint and take a radiograph immediately after the injection. Another is a pneumoorthography or the negative contrast orthography, in which we have to inject air inside the synovial cavity or the new joint so that the soft tissue can be studied. This technique is based on the fact that air is less radio opaque than structures such as medial and the lateral menisci are clearly visualized in the radiograph. Another technique is bronchogram. So, bronchogram is a contrast radiography of the bronchial tree. So, this bronchogram is indicated for the any type of bronchitis, asthma, or any type of diseases related with the bronchial tree or the lungs. For that, we have to use oily contrast media, iodine based oily contrast media, approx 5 to 30 ml in a small animal. So, this is a lateral view of a bronchogram. You have to clearly appreciate the bronchial tree in the ventrodorsal view of a radiograph. You can clearly view appreciate the bronchial tree. Another is a angiocardiography, that means a contrast radiography of heart and the major blood vessel is called as angiocardiography, which is indicated for the obtained specific type of diagnosis to define a lesion related to the heart or the major blood vessels. This angiocardiography is contraindicated in the severe respiratory diseases and congestive heart failure cases. For that, we can use a contrast agent, sodium dihydrozoate, at the dose rate of 2 ml per kg of body weight. So, this is a lateral view of angiocardiography. So, you can clearly appreciate the pulmonary arteries and the right ventricles. Thank you for your patience.